Hey everyone, welcome back to our channel. Today, we're diving into a critical topic that affects millions of people worldwide: liver health. Your liver plays a vital role in your body's overall function, but many everyday habits can unknowingly harm this essential organ. So, what are these daily habits that can damage your liver? Stick around as we reveal the top 12 habits you need to be aware of and how to protect your liver from harm. First, let's talk about some common symptoms that indicate your liver might be in trouble. Have you experienced unexplained fatigue, yellowing of the skin or eyes, dark urine, or abdominal pain? These could be signs that your liver is struggling to keep up with your lifestyle choices. Now, let's get into the causes. From consuming too much alcohol and eating a diet high in fatty foods to smoking and taking certain medications without proper guidance, we'll cover how these habits and more can negatively impact your liver. Awareness is the first step towards prevention. By understanding these harmful habits, you can take proactive steps to protect your liver. We'll also share some practical tips on how to maintain a liver-friendly lifestyle. So, stay tuned, because your liver health is worth it. Let's get started with our list of 12 daily habits that can damage your liver. 1. Excessive alcohol consumption. Excessive alcohol consumption is one of the daily habits that can cause severe damage to the liver. When alcohol is metabolized in the liver, liver enzymes break it down into non-toxic substances. However, consuming alcohol excessively overworks the liver, leading to the accumulation of harmful substances such as acetaldehyde. Initially, excessive alcohol intake can cause fatty liver disease, a condition where fat accumulates in liver cells. If drinking continues, the liver can become inflamed, resulting in alcoholic hepatitis. In the final stages, the damage becomes more severe, leading to cirrhosis, where liver tissue is replaced by scar tissue, impairing liver function. Cirrhosis is the most serious consequence of excessive drinking, potentially leading to liver failure and life-threatening complications such as liver cancer, gastrointestinal bleeding, and immune system suppression. To protect your liver, it is essential to limit alcohol consumption and follow guidelines for safe drinking levels. 2. Smoking. Smoking is a habit that harms not only the lungs but also the liver. When you smoke, the harmful chemicals in cigarette smoke are absorbed into the bloodstream and transported to the liver. Consequently, the liver has to work harder to process and eliminate these toxins, leading to oxidative stress and liver cell damage. Initially, the liver may cope with these harmful substances, but over time, their accumulation can result in liver inflammation and impaired liver function. Smoking also increases the risk of non-alcoholic fatty liver disease, NAFLD, a condition where fat accumulates in the liver. If left unchecked, smoking can lead to cirrhosis, where liver tissue is replaced by scar tissue, causing loss of liver function. Furthermore, smoking significantly raises the risk of liver cancer, a disease with a high mortality rate. To protect your liver, it is crucial to quit smoking and avoid exposure to secondhand smoke. Seeking support from smoking cessation programs and healthcare professionals can help you break this harmful habit. Quitting smoking not only safeguards your liver but also enhances your overall health and well-being. 3. Consuming foods high in fat. Consuming foods high in fat is one of the primary causes of liver damage. When you eat fatty foods, the fat is metabolized and stored in the liver. Consequently, the liver has to work harder to process the excess fat, leading to the accumulation of fat in liver cells. Initially, the liver can store a small amount of fat without causing harm. However, as fat accumulation increases, the liver starts to develop non-alcoholic fatty liver disease, NAFLD. If left unchecked, this condition can progress to non-alcoholic steatohepatitis, NASH, which causes inflammation and liver damage. If not treated, NASH can lead to cirrhosis, a condition where liver tissue is replaced by scar tissue, resulting in loss of liver function. Cirrhosis is a severe condition that can lead to liver failure and other dangerous complications, such as liver cancer and acute liver failure. To protect your liver, it is essential to maintain a balanced diet and limit the consumption of high-fat foods. Instead, focus on eating plenty of vegetables, fruits, and whole grains. 4. Consuming too much soda. Consuming too much soda is a common habit that can severely harm the liver. Soda contains high amounts of sugar and various chemicals, which puts significant pressure on the liver to process. Excess sugar, particularly fructose, is metabolized into fat in the liver. Initially, the accumulation of excess sugar and fat in the liver can lead to non-alcoholic fatty liver disease, NAFLD. Over time, this condition can cause liver inflammation, progressing to non-alcoholic steatohepatitis, NASH. If left untreated, NASH can develop into cirrhosis, where liver tissue is replaced by scar tissue, leading to a loss of liver function. Cirrhosis can result in liver failure and other dangerous complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to limit soda consumption and replace it with healthier alternatives like water, herbal tea, or natural fruit juices. 5. Consuming too much fast food. Consuming too much fast food is a common habit in modern life, but it can severely damage the liver. Fast food often contains high levels of fat, sugar, and salt, along with preservatives and additives. When consumed in large quantities, these substances put significant pressure on the liver, forcing it to work overtime to metabolize and eliminate them. Initially, consuming too much fast food can lead to the accumulation of fat in the liver, resulting in non-alcoholic fatty liver disease, NAFLD. Over time, this condition can cause liver inflammation and damage, progressing to non-alcoholic steatohepatitis, NASH. If left unchecked, NASH can develop into cirrhosis, where liver tissue is replaced by scar tissue, leading to a loss of liver function. Cirrhosis can result in liver failure and other severe complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to limit fast food consumption and replace it with healthy, nutrient-rich meals. Increasing your intake of vegetables, fruits, and whole grains is essential. 6. Improper medication dosage. Taking medication improperly is a dangerous habit that can severely damage the liver. When medications are taken beyond the prescribed dosage, the liver must work overtime to metabolize and eliminate the chemical compounds in the drugs. This overburdening leads to the accumulation of harmful substances in the liver, causing damage to liver cells. Initially, this can result in inflammation and stress on the liver. If this condition persists, the damage can become more severe, leading to drug-induced hepatitis, which impairs liver function and can even cause liver cell necrosis. If left unchecked, drug-induced hepatitis can progress to cirrhosis, where liver tissue is replaced by scar tissue, resulting in a loss of liver function. Cirrhosis can lead to liver failure and other dangerous complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to adhere to the prescribed medication dosage and not to self-adjust the dosage. Always read medication instructions carefully and seek medical advice if you have any questions. Proper medication use not only protects your liver but also ensures safety and effectiveness in treating your health conditions. 7. Consuming too much salt. Consuming too much salt is a common habit that can severely damage the liver. When you consume excessive salt, your body retains water to maintain electrolyte balance. This retention creates pressure on the liver to process and eliminate the excess salt, leading to oxidative stress and liver cell damage. Initially, consuming too much salt can cause water retention and increased blood pressure, putting additional strain on the liver. Over time, the liver can become inflamed and damaged due to the accumulation of salt and water, potentially leading to fatty liver disease and hepatitis. If left unchecked, this inflammation can progress to cirrhosis, where liver tissue is replaced by scar tissue, resulting in a loss of liver function. Cirrhosis can lead to liver failure and other dangerous complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to limit salt intake and replace it with healthier seasonings. Maintaining a balanced diet and minimizing the use of processed foods, which often contain high levels of salt, is essential. 8. Irregular eating. Irregular eating habits are detrimental to overall health, particularly to the liver. When you eat irregularly, your liver must work without a consistent schedule to metabolize and process nutrients, leading to stress and damage to liver cells. The sudden changes in nutrient and energy intake can disrupt the liver's metabolic processes. Initially, the liver may try to adapt to the erratic eating schedule. However, if this pattern continues, the liver will suffer damage from overwork and inconsistency, leading to inflammation and fatty liver disease. If left unchecked, inflammation and fatty liver disease caused by irregular eating habits can progress to cirrhosis, where liver tissue is replaced by scar tissue, resulting in a loss of liver function. Cirrhosis can lead to liver failure and other severe complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to maintain a regular and balanced eating schedule. Try to eat at consistent times each day and ensure that your diet provides the necessary nutrients. 9. Sleep deprivation. Sleep deprivation is a common habit that can severely damage the liver. When you lack sleep, your body does not have enough time to recover and regenerate. Consequently, the liver is also affected as it doesn't get sufficient time to perform its detoxification and metabolic functions, leading to oxidative stress and liver cell damage. Initially, sleep deprivation can cause stress and fatigue for the liver. Over time, the liver will suffer damage from overworking without adequate recovery time, potentially leading to inflammation and fatty liver disease. If left unchecked, inflammation and fatty liver disease caused by sleep deprivation can progress to cirrhosis, where liver tissue is replaced by scar tissue, resulting in a loss of liver function. Cirrhosis can lead to liver failure and other severe complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to ensure you get enough sleep each night. Try to maintain a regular sleep schedule and avoid factors that can disrupt sleep, such as stress and caffeine consumption in the evening. 10. Not drinking enough water. Not drinking enough water is a common habit that can severely damage the liver. When the body lacks sufficient water, the liver cannot fully perform its vital functions, including detoxification and nutrient metabolism. This water deficiency leads to reduced blood flow to the liver, impairing its ability to remove toxins and waste products from the body. Initially, dehydration can cause stress on the liver and reduce the efficiency of its functions. Over time, the liver becomes damaged due to the accumulation of toxins and waste products that are not properly eliminated. This can lead to inflammation and fatty liver disease. If left unchecked, inflammation and fatty liver disease caused by dehydration can progress to cirrhosis, where liver tissue is replaced by scar tissue, resulting in a loss of liver function. Cirrhosis can lead to liver failure and other severe complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to ensure you drink enough water every day. This habit helps the liver function efficiently and maintains overall health. 11. Not eating enough vegetables and fruits. Not eating enough vegetables and fruits is an unhealthy dietary habit that can severely damage the liver. Vegetables and fruits provide essential vitamins, minerals, and antioxidants needed by the body. Without these nutrients, the liver lacks the support it needs to perform its detoxification and metabolic functions. Antioxidants in vegetables and fruits protect the liver from free radicals and oxidative stress. Initially, not consuming enough vegetables and fruits can reduce the liver's self-repair capabilities and increase the risk of liver inflammation. The deficiency of essential nutrients also makes the liver more vulnerable to toxins and other harmful factors. Over time, this can lead to fatty liver disease and hepatitis. If left unchecked, hepatitis and fatty liver disease caused by a lack of vegetables and fruits can progress to cirrhosis, where liver tissue is replaced by scar tissue, resulting in a loss of liver function. Cirrhosis can lead to liver failure and other severe complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to ensure you eat enough vegetables and fruits daily. These foods not only provide essential nutrients but also help the liver function more efficiently. 12. Prolonged stress. Prolonged stress is a common condition in modern life that can severely damage the liver. When the body experiences prolonged stress, the endocrine system produces stress hormones such as cortisol. Continuously high levels of cortisol can cause oxidative stress and inflammation in the liver. Additionally, prolonged stress affects metabolic processes, causing the liver to work harder to maintain homeostasis. Initially, prolonged stress may cause mild inflammation and stress on the liver. Over time, the liver becomes damaged from constant exposure to stress hormones and related metabolites, potentially leading to fatty liver disease and hepatitis. If left unchecked, hepatitis and fatty liver disease caused by prolonged stress can progress to cirrhosis, where liver tissue is replaced by scar tissue, resulting in a loss of liver function. Cirrhosis can lead to liver failure and other severe complications, such as liver cancer and acute liver failure. To protect your liver, it is crucial to manage stress effectively. This can include regular exercise, practicing yoga or meditation, and maintaining positive social relationships. If prolonged stress affects your health, seek advice from a psychologist or doctor for timely intervention and to safeguard your liver health. Here are 5 ways to keep your liver healthy. 1. Drink enough water. Water helps the liver function effectively in detoxification. Water is a necessary environment for chemical reactions to take place, helping the liver remove toxic substances from the body. 2. Limit alcohol consumption. Alcohol can damage liver cells, leading to hepatitis, fatty liver, and cirrhosis. 3. Maintain a healthy weight. Obesity is the main cause of non-alcoholic fatty liver disease, NAFLD, increasing the risk of cirrhosis. 4. Exercise regularly. Exercise helps improve liver function, enhance blood circulation, and reduce stress. 5. Consume foods containing omega-3. Omega-3 has anti-inflammatory properties, helping to reduce liver inflammation and improve liver function. Today, we're exploring a vital aspect of health, the liver. As your body's ultimate multitasker, the liver tirelessly filters toxins, aids in digestion, and stores energy, making it indispensable to your overall well-being. However, what you consume directly impacts its health. Your diet can either support the liver's functions or contribute to serious conditions like fatty liver, hepatitis, and even liver failure. Understanding which foods to avoid is crucial for maintaining optimal liver health. From sugary treats to processed snacks, certain foods pose risks to this essential organ. In this video, we'll delve into 10 foods notorious for harming your liver if consumed excessively. We'll discuss how these foods affect liver function, which bodily processes they impact, and why it's imperative to moderate or eliminate them from your diet. Stick around until the end where we'll reveal a list of foods that actively promote liver health. Let's embark on this journey to better liver health together, starting now. 1. Artificial sweeteners. Have you ever wondered how artificial sweeteners affect your liver? Artificial sweeteners like aspartame, saccharin, and sucralose are commonly used as sugar substitutes, but they may wreak havoc on your gut health, indirectly impacting your liver function. These sweeteners can disrupt the balance of beneficial bacteria in your gut, leading to a condition called dysbiosis, where harmful bacteria outnumber the good ones. This imbalance can increase intestinal permeability, allowing toxins like endotoxins to enter the bloodstream and reach your liver. Once in the liver, these toxins force it into overdrive, triggering inflammation and oxidative stress. This stress can damage liver cells and impair its ability to function properly. What's more, artificial sweeteners can induce metabolic changes in the liver, negatively affecting its processes. Consuming these sweeteners might lead to insulin resistance, where your body's cells become less responsive to insulin. This resistance prompts the liver to produce more glucose and store extra fat, potentially leading to non-alcoholic fatty liver disease. As fat accumulates in the liver, inflammation and cell damage can escalate, progressing to more severe conditions like non-alcoholic steatohepatitis, fibrosis, and even cirrhosis. 2. High-sodium foods. Did you know that consuming too much sodium can impact your liver health? High levels of sodium in your diet can lead to elevated blood pressure, a condition known as hypertension. This increase in blood pressure places added strain on the liver, as it works harder to manage the increased blood flow. Over time, this strain can damage the liver's blood vessels, impairing its ability to effectively filter toxins and process nutrients. In addition to hypertension, high sodium intake causes the body to retain more water, leading to increased blood volume. This water retention further burdens the liver, potentially causing swelling and inflammation. As a result, the liver becomes less efficient at its vital tasks of filtering blood and metabolizing nutrients, which can worsen existing liver conditions or contribute to the development of new ones. Furthermore, high sodium levels can induce cellular stress within the liver. Sodium disrupts the balance of electrolytes within liver cells, leading to cellular dysfunction and triggering oxidative stress. This stress occurs when reactive oxygen species accumulate and damage liver cells, proteins, and DNA, contributing to liver inflammation and conditions like non-alcoholic fatty liver disease and liver fibrosis. Research has shown that consuming more than 9.5 grams of salt per day is associated with a higher risk of developing non-alcoholic fatty liver disease. 3. Sugary foods and beverages. Ever wondered how sugary foods and drinks affect your liver? When you consume these treats, they often pack a punch of fructose, glucose, and sucrose. Fructose, in particular, is primarily metabolized in the liver. Unlike glucose, which can be processed by various cells in the body, fructose undergoes transformation into fat within liver cells. This process can lead to the accumulation of fat, known as non-alcoholic fatty liver disease. Over time, this buildup of fat can trigger inflammation and damage to liver cells, potentially progressing to more serious conditions like non-alcoholic steatohepatitis, fibrosis, and even cirrhosis. Additionally, a high intake of sugary foods and beverages may contribute to insulin resistance. Insulin is crucial for regulating blood sugar levels, but excessive sugar intake can reduce the body's responsiveness to insulin, prompting the pancreas to produce more. This insulin resistance leads to elevated levels of both insulin and glucose in the bloodstream, further promoting fat storage in the liver. Such conditions exacerbate non-alcoholic fatty liver disease and heighten the risks of liver inflammation and damage. Research has shown that increased fructose consumption significantly raises the likelihood of developing non-alcoholic fatty liver disease. 4. Processed foods. Have you ever wondered about the impact of processed foods on your liver? Trans fats, found abundantly in snacks, fast food, and baked goods, are artificially created through hydrogenation to prolong shelf life. Despite their convenience, these fats pose a challenge for the liver, which struggles to break them down and process them efficiently. Over time, consuming trans fats can lead to the accumulation. This buildup can progress to more severe liver damage. Moreover, processed foods often contain a cocktail of artificial additives like preservatives, flavor enhancers, and colorings. These chemicals add an additional burden. Constant exposure to these additives may trigger liver inflammation, compromising its vital functions. 5. Fried foods. Fried foods are often loaded with unhealthy fats, particularly trans fats and saturated fats. Consuming these fats in excess overwhelms the liver's ability to metabolize them efficiently, leading to the buildup of fat within liver cells. This fat accumulation can trigger liver inflammation and scarring, impairing liver function and increasing the risk of serious liver conditions. Moreover, the high-temperature frying process produces harmful compounds like advanced glycation end products, AGEs, and acrylamide. AGEs form when proteins or fats combine with sugars during cooking, contributing to oxidative stress and inflammation in the liver. Acrylamide, another harmful compound formed at high temperatures, may also contribute to liver toxicity, damaging liver cells and impairing detoxification processes. Additionally, fried foods are calorie-dense, which can contribute to obesity and metabolic syndrome. Both conditions are major risk factors for developing non-alcoholic fatty liver disease, NAFLD. Excess body weight and metabolic imbalances strain the liver further, promoting fat accumulation and inflammation. As the liver struggles to manage the excess calories and fat intake, its ability to function properly diminishes, heightening the risk of liver disease. Research indicates that a significant portion of patients with hepatic steatosis, or fatty liver disease, consumed higher amounts of fried foods compared to those without the condition. 6. White bread and rice. Both these foods have a high glycemic index, meaning they can cause rapid spikes in blood sugar levels after consumption. When you eat high glycemic index foods, your body quickly converts them into glucose, leading to a sudden increase in blood sugar levels. This spike triggers the pancreas to release large amounts of insulin to help cells absorb the glucose. Over time, these frequent spikes in blood sugar and insulin levels can overwhelm the liver's ability to regulate glucose properly. This imbalance can result in the liver converting excess glucose into fat, leading to a condition called non-alcoholic. Furthermore, white bread and rice are low in dietary fiber, which is essential for healthy digestion and stable blood sugar levels. The lack of fiber means these foods do not slow down the absorption of glucose, exacerbating the spikes in blood sugar and insulin levels. This places additional strain on the liver as it tries to manage these fluctuations, contributing further to fat accumulation and inflammation. A diet low in fiber can also impact gut health, indirectly affecting liver function by promoting systemic inflammation. 7. Red meat. Red meat is rich in saturated fats, which pose a challenge for the liver to process efficiently. Consuming large amounts of saturated fats can lead to the accumulation of fat in the liver, a condition known as non-alcoholic fatty liver disease. This buildup of fat within liver cells triggers inflammation and can cause damage over time. Furthermore, red meat contains high levels of cholesterol, another factor that can contribute to liver damage. Excessive dietary cholesterol may lead to the formation of cholesterol deposits in the liver, which can cause inflammation and impair liver function. High cholesterol levels in the blood may also contribute to the development of gallstones, obstructing bile flow and adding further stress to the liver. In addition to saturated fats and cholesterol, red meat is a significant source of heme iron, which is more easily absorbed by the body compared to non-heme iron found in plant-based foods. While iron is essential, excessive intake of heme iron can lead to iron overload in the liver, a condition called hemochromatosis. This can result in the accumulation of iron in liver cells, causing oxidative stress and cell damage. The cumulative effects of saturated fats, cholesterol, and heme iron in red meat can severely impair liver function and increase the risk of liver diseases such as cirrhosis and liver cancer. 8. Carbonated beverages. Carbonated beverages, especially those high in fructose and other sugars, can have detrimental effects on liver health. When you consume these drinks, the liver metabolizes the fructose, converting it into fat. This process can lead to the accumulation of fat within liver cells, a condition known as non-alcoholic fatty liver disease, NAFLD. The liver's struggle to process these excess sugars also results in oxidative stress, causing further damage to liver cells. Moreover, carbonated beverages often contain artificial additives like preservatives, flavor enhancers, and colorings. These chemicals add to the burden on the liver, which works overtime to detoxify and eliminate them from the body. Continuous exposure to these additives may lead to liver inflammation and increased oxidative stress, further impairing liver function over time. The resulting oxidative stress can damage liver cells, leading to ongoing inflammation and potentially worsening liver health. The liver's attempts to repair this damage may lead to more inflammation and scarring, exacerbating liver conditions. Additionally, frequent consumption of carbonated beverages is associated with an increased risk of metabolic syndrome, a cluster of conditions including obesity, insulin resistance, high blood pressure, and abnormal cholesterol levels. Metabolic syndrome is a significant risk factor for developing NAFLD and can progress to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, and liver fibrosis. 9. High-fat dairy products. High-fat dairy products often contain significant amounts of saturated fats, which pose a challenge for the liver to process efficiently. When you consume saturated fats, they can accumulate in liver cells, leading to the development of non-alcoholic fatty liver disease, NAFLD. This condition arises from the excess buildup of fat in the liver, which can cause inflammation and damage to liver cells. Continued consumption of saturated fats can exacerbate this fat accumulation over time, potentially progressing to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, and cirrhosis. Additionally, high-fat dairy products are rich in cholesterol. Excessive dietary cholesterol may contribute to the formation of cholesterol deposits within the liver, triggering inflammation and impairing liver function. Elevated cholesterol levels in the bloodstream can also increase the risk of developing gallstones, which may obstruct bile flow and add further stress to the liver. The liver's efforts to process and eliminate excess cholesterol can lead to ongoing inflammation and scarring, worsening liver health. Research involving 7,500 participants has shown that those consuming higher amounts of dairy, cheese, and yogurt had elevated fatty liver index levels. This underscores the potential impact of high-fat dairy on liver health. 10. Alcohol. Alcohol itself is a toxin, and when the liver metabolizes it, it converts alcohol into acetaldehyde, a highly toxic substance. Acetaldehyde can damage liver cells, leading to inflammation and scarring. This damage disrupts the liver's normal functions, impairing its ability to process nutrients and filter toxins from the bloodstream. Moreover, the metabolism of alcohol in the liver produces reactive oxygen species, ROS, harmful molecules that cause oxidative stress. Oxidative stress occurs when there's an imbalance between ROS production and the liver's detoxification capacity. Over time, this stress can damage liver cells, proteins, and DNA, contributing to ongoing inflammation and eventual cell death. These effects can lead to significant liver injury, contributing to conditions like alcoholic hepatitis and cirrhosis. Additionally, excessive alcohol consumption disrupts the liver's ability to metabolize fats properly, leading to the accumulation of fat within liver cells. This condition, known as fatty liver disease, is an early stage of alcohol-related liver disease and can progress to more severe conditions like alcoholic hepatitis. As fat continues to accumulate, it causes further inflammation and scarring, progressively impairing liver function. Experts suggest that even moderate alcohol intake, such as 20 grams per day for women and 30 grams per day for men, can worsen liver damage. It's crucial to be aware of these risks and consider healthier alternatives for liver health. Now that you understand the potential risks of certain foods and drinks for your liver, it's crucial to prioritize liver health in your diet. Here are 5 foods and drinks known to support and protect your liver. 1. Green tea. Known for its antioxidant properties, green tea can help reduce fat accumulation in the liver, promote liver function, and protect against liver diseases. 2. Fatty fish. Rich in omega-3 fatty acids, fatty fish like salmon, mackerel, and sardines can help reduce inflammation and support liver function. 3. Leafy greens. Vegetables like spinach, kale, and arugula are packed with vitamins, minerals, and antioxidants that support liver detoxification and overall health. 4. Turmeric. This spice contains curcumin, a compound with powerful anti-inflammatory and antioxidant properties that may help protect liver cells from damage. 5. Coffee. Studies suggest that moderate coffee consumption may lower the risk of liver diseases such as cirrhosis and liver cancer, thanks to its beneficial compounds. Incorporating these foods and drinks into your diet can help maintain and promote liver health. 8 signs of liver disease at night you shouldn't ignore. Did you know that liver disease doesn't take a break when the sun goes down? In fact, nighttime can reveal a unique set of symptoms that are crucial for anyone with liver disease to recognize. Identifying these signs can help you stay on top of your health and ensure a good night's sleep. In this video, we'll uncover the often hidden signs of liver disease that can appear at night. These nighttime symptoms offer important clues about potential underlying health issues. If you're experiencing any of the symptoms mentioned, please share your experience in the comments below. Let's raise awareness and support each other on this health journey. Don't forget to like, subscribe, and hit the notification bell for more health tips and information. Number 1 on our list, nighttime muscle cramps. These cramps can be more than just a painful nuisance, they might be a signal of an underlying liver issue. Imagine being jolted awake by a sudden, intense cramp in your leg. Your muscle tightens and contorts painfully, leaving you rubbing and stretching in a desperate attempt to find relief. These cramps can last from a few seconds to several minutes and can recur multiple times throughout the night, making restful sleep seem impossible. The liver is essential for maintaining a balance of electrolytes and minerals in your body, which are crucial for proper muscle function. When the liver isn't functioning correctly due to disease, it can lead to imbalances in electrolytes like calcium, potassium, and magnesium, causing muscles to cramp and spasm. Additionally, liver disease can result in poor circulation and reduced oxygen supply to the muscles, further contributing to the frequency and severity of muscle cramps. To help manage and prevent nighttime muscle cramps, include foods rich in essential minerals like potassium, magnesium, and calcium in your diet, such as bananas, leafy greens, nuts, seeds, and dairy products. Avoid excessive alcohol and salty foods, as they can disrupt your electrolyte balance. Drink plenty of water throughout the day, and consider keeping a glass of water by your bedside in case you wake up thirsty. Gentle stretching exercises before bed can help relax your muscles and reduce the likelihood of cramps, especially focusing on your legs and feet. If you experience a cramp, massaging the affected muscle and applying warmth, like a warm towel or heating pad, can help alleviate the pain and relax the muscle. Number 2 on our list is itchy skin. Picture this: you're cozied up in bed, drifting off to sleep, and suddenly you're hit with an intense urge to scratch. It's not just a mild itch, it's an unrelenting need to scratch that keeps you awake and frustrated. This itchiness can be localized or widespread and often feels more intense at night, disrupting your precious sleep. So, what's the deal with this nocturnal itching? Liver disease can cause a buildup of bile salts in your bloodstream. Normally, your liver processes these bile salts to aid digestion. However, when your liver is compromised, it can't filter out these substances efficiently. As a result, these bile salts accumulate and deposit under your skin, causing that relentless itch. If itchy skin is becoming a nightly struggle, here are some tips that might help. Use a good quality moisturizer to keep your skin hydrated, as dry skin can exacerbate itching. Apply lotion generously, especially after bathing. Hot water can strip your skin of natural oils and worsen the itching, so opt for lukewarm showers and use gentle, fragrance-free soaps to keep your skin calm. Over-the-counter anti-itch lotions or creams containing ingredients like menthol or camphor can provide temporary relief. Antihistamines might also help, but consult with your healthcare provider before taking any new medication. Keeping your bedroom cool can help reduce itching. Use a fan, lightweight bedding, and wear loose, breathable pajamas to keep your skin comfortable. In some cases, medications that reduce bile salts or address liver function may be necessary. Your healthcare provider can advise you on the best course of action based on your specific condition. Number 3 on our list is night sweats. If you're waking up in the middle of the night drenched in sweat, with your pajamas sticking to your skin and your sheets damp, you may want to look into why. These episodes can range from mildly annoying to severely disruptive, making it hard to get a good night's rest. Night sweats in the context of liver disease can be attributed to several factors. The liver is responsible for filtering toxins from the blood. When it's not functioning properly, these toxins can accumulate in your system, potentially causing your body to react with night sweats. Additionally, liver disease can disrupt the balance of hormones in your body, including those that regulate temperature, leading to excessive sweating, particularly at night. Chronic liver disease can sometimes be associated with low-grade infections or inflammation, which can cause your body to produce sweat in an attempt to regulate temperature. The liver also plays a key role in metabolism. Liver disease can alter metabolic processes, leading to changes in body temperature regulation and causing night sweats. It's important to speak with your doctor to determine if liver disease is the cause of your night sweats. They can run tests to diagnose liver problems and recommend appropriate treatments. Eating a balanced diet can support liver health, so focus on foods that are rich in antioxidants, vitamins, and minerals. Avoid alcohol and limit consumption of fatty, fried, and sugary foods. Spicy foods and caffeine can trigger sweating, so try to avoid these, especially in the evening, to reduce the likelihood of night sweats. Number 4 on our list is insomnia. Imagine lying in bed, staring at the ceiling, and counting endless sheep with no sign of sleep in sight. Your mind races, your body feels restless, and as the hours tick by, you get more and more frustrated. Even when you do manage to drift off, it's a fitful sleep that leaves you feeling exhausted the next day. So, what's the connection between liver disease and insomnia? The liver plays a crucial role in detoxifying your blood and managing various metabolic processes. When liver function is impaired, toxins can build up in the bloodstream and affect brain function, leading to a disruption in your body's natural sleep-wake cycle, making it difficult to get a good night's sleep. Additionally, liver disease can cause imbalances in hormones and neurotransmitters, such as melatonin and serotonin, which are critical for regulating sleep. These imbalances can further contribute to insomnia. If insomnia is becoming your nightly nemesis, here are some tips to help you manage it. It's essential to see your doctor if you're experiencing persistent insomnia. Blood tests can help determine if liver disease is the underlying cause, and your healthcare provider can recommend appropriate treatments. Establishing a calming pre-sleep routine can help signal to your body that it's time to wind down. This might include activities like reading, taking a warm bath, or practicing gentle yoga or meditation. Try to go to bed and wake up at the same time every day, even on weekends. Consistency reinforces your body's sleep-wake cycle. The blue light emitted by phones, tablets, and computers can disrupt your body's production of melatonin, making it harder to fall asleep. Aim to turn off screens at least an hour before bedtime. Make your bedroom a haven for sleep by keeping it cool, dark, and quiet, and invest in a comfortable mattress and pillows. Before we cover the next symptom, don't forget to like and subscribe. Number 5 on our list is restless leg syndrome, RLS. Restless leg syndrome can be a real nighttime nuisance, and it might surprise you to know that it can be linked to liver disease. Imagine settling into bed, ready for a good night's sleep, and suddenly feeling an uncontrollable urge to move your legs. It's like having ants in your pants, except they're actually in your legs. These sensations can range from a mild tickle to an aching or even a creepy, crawly feeling that just won't quit. The result? Tossing, turning, and a serious case of the sleepless blues. So, why does this happen? Liver disease can cause peripheral neuropathy, a condition where the nerves outside your brain and spinal cord are damaged. When your liver isn't functioning properly, toxins can build up in your bloodstream, which can harm these peripheral nerves. This nerve damage sends jumbled signals to your brain, tricking it into thinking your legs need to move constantly to relieve the discomfort. If RLS is keeping you up at night, it's important to address it. Ensure you're getting enough nutrients, particularly those that support nerve health, like iron, magnesium, and B vitamins. Avoid alcohol, as it can worsen liver function and nerve damage. Keep a regular sleep schedule and create a calming bedtime routine. Reducing stress and practicing relaxation techniques can also help. Drink plenty of water throughout the day to help your body flush out toxins and maintain overall health. Number 6 on our list is waking up with nausea. You're in the middle of a deep sleep when suddenly you wake up with a queasy, unsettled feeling in your stomach. You might feel like you're on the verge of vomiting, and the sensation can be accompanied by a sour taste in your mouth or excessive salivation. This discomfort can make it hard to get back to sleep, leaving you tired and frustrated. One of the liver's primary roles is to filter out toxins from the blood. When the liver is not functioning properly, these toxins can accumulate and affect various bodily functions, including digestion. This buildup of toxins can lead to feelings of nausea, particularly at night. Liver disease can disrupt bile production and flow, leading to digestive issues such as indigestion or acid reflux, which can cause nausea. Additionally, liver disease can alter the balance of hormones in your body, including those that regulate digestion and appetite, further contributing to nausea. If you're waking up with nausea, here are some steps you can take to manage it. Consult your doctor, who might recommend medications or supplements to help manage nausea. Always follow their advice for safe and effective treatment. Using extra pillows to elevate your head can help prevent acid reflux, which can cause nausea during the night. Maintaining a healthy diet, avoiding late-night meals, and steering clear of foods that trigger indigestion can also help. Number 7 on our list is frequent urination. Next up in our nocturnal adventures is finding yourself sprinting to the bathroom multiple times during the wee hours. It might be more than just an annoying disruption to your sweet dreams. It could be a signal from your body about liver issues. Liver disease can cause fluid retention and diuretic effects, leading to increased urine production, especially at night. When the liver is not functioning properly, it can lead to an imbalance in the body's fluid regulation. This often results in the accumulation of fluid in the tissues, known as edema. To compensate, your body might increase urine production to get rid of the excess fluid, causing you to wake up frequently during the night to urinate. This frequent urination can severely disrupt your sleep, leaving you feeling exhausted and irritated during the day. To manage this symptom, it's essential to adopt some practical habits. Limiting your fluid intake in the evening can reduce the likelihood of needing to urinate during the night. It's also wise to avoid beverages that can act as diuretics, such as those containing caffeine and alcohol, as they can increase urine production. By addressing the root cause and making lifestyle adjustments, you can reduce the frequency of nighttime urination, ensuring better sleep and overall well-being. Number 8 on our list is darker urine. Waking up to find your urine is dark brown or tea-colored instead of the usual pale yellow can be alarming and may indicate an underlying health issue, such as liver disease. This change in urine color can be quite unsettling, especially if it happens frequently. Dark urine can be accompanied by other symptoms like a strong odor, fatigue, or abdominal discomfort, making it even more concerning. In the context of liver disease, dark urine is typically due to the buildup of bilirubin, a yellow compound that forms as red blood cells break down. Normally, the liver processes bilirubin, which is then excreted in bile and removed from the body through the digestive tract. When the liver is damaged, it cannot process bilirubin effectively, leading to its accumulation in the blood. This excess bilirubin is then excreted through the kidneys, causing the urine to appear dark. Liver disease can also cause dehydration, which concentrates the urine and makes it appear darker. This is particularly noticeable when you haven't had enough fluids, such as first thing in the morning. Certain medications or toxins that affect liver function can also cause dark urine. If the liver is struggling to filter these substances out, they can change the color of your urine. In severe cases, dark urine may contain blood due to complications of liver disease, such as bleeding disorders. This requires immediate medical attention. It's crucial to talk to your doctor if you notice dark urine, especially if it's persistent. They can conduct tests to determine if liver disease is the cause and suggest appropriate treatments. To help maintain liver health and prevent further complications, limit exposure to environmental toxins and chemicals that strain your liver. This includes avoiding excessive alcohol consumption and being cautious with over-the-counter pain relievers and herbal supplements. By understanding these nighttime symptoms of liver disease and taking proactive steps, such as regular checkups and open communication with your healthcare provider, you can better manage your health and overall well-being. I like to share with you the number one, absolute worst food that you could consume for your liver. Especially if you're concerned about developing a fatty liver, and hint, it's not sugar. It's not carbs. And this particular ingredient is not even high fructose corn syrup, even though sugar, starch, and high fructose corn syrup are really bad for the liver. There's something much worse. The big problem with the liver is that there are very few symptoms that occur with liver issues. I had a liver problem for probably, 22 years. I didn't know it was a liver problem. I had some symptoms, but I didn't connect the dots. A lot of my symptoms were in my right shoulder, right through this trap right here, and right back into the scapula. Additionally, right underneath my right rib cage, it was always painful, sore, tight, and bloated for years. I didn't know what that was. This problem was related to my bile duct, the little tubes that connect to the gallbladder, which is part of the liver because the liver makes bile. I had this problem for a very long time, and that's why I do a lot of videos on the liver, because I completely reversed it. This brings me to a big myth that I want to talk about. People think that once you have a liver problem, you always have a liver problem. Absolutely not. The liver is incredibly robust and resilient. It's one of the only organs that can completely regenerate. Another myth is that the liver is filled with toxins and is very toxic. That's not true. The liver detoxifies poisons, it doesn't store them. Fat cells store poisons. The liver gets rid of toxins. Once the liver starts developing scar tissue and getting into cirrhosis, the risk of liver cancer goes way up. The treatment options the medical profession offers are not very good. It's often just a liver transplant, and you end up on a waiting list. There's not a lot of healthy livers available for transplants, so you're playing a waiting game, hoping you'll survive long enough to get a liver. Then, if you get a liver, you have to take anti-rejection medications like prednisone, which come with their own side effects. The simple solution is to prevent liver problems in the first place. There was an interesting study on rats that I want to tell you about. There were 3 groups of rats. In the first group, they were fed lard and alcohol. Lard is pig fat. The second group was fed beef fat, called tallow, and alcohol. The third group was fed corn oil and alcohol. What's interesting is that the first group, the lard and alcohol group, had minimal liver damage. The second group, with tallow and alcohol, had virtually no liver damage. This suggests that beef fat could potentially be protective to the liver. It's fascinating, especially since I consume a lot of beef fat in my diet, and I don't have liver problems anymore. But the third group, the corn oil and alcohol group, had severe liver damage. The worst food or ingredient for a fatty liver or a liver, in general, is seed oils. Seed oils are very inflammatory and damaging, especially the way they are processed. Seed oils, often misleadingly labeled as vegetable oils, are primarily composed of omega-6 fatty acids, particularly linoleic acid. These oils undergo extensive processing, leading to oxidation and the creation of free radicals, which are highly damaging to the liver and other tissues. Our diets are composed of far too much omega-6 fatty acids, between 25 to 30% of our calories. In contrast, healthier fats like lard, pig fat, contain about 2.5% linoleic acid, and tallow, beef fat, contains only 0.7%, while corn oil contains a staggering 56.6% linoleic acid. The issue with seed oils is that they get lodged in our cells and tissues, leading to long-term inflammation. Unlike sugars, which are metabolized relatively quickly, these fats stay in our system for 2 to 3 years. They get incorporated into cell membranes and hormone structures, creating chronic inflammation, especially in the liver, leading to insulin resistance and further complications. To improve liver health, the first step is to eliminate seed oils from your diet. This involves reading ingredient labels carefully and avoiding foods fried in these oils, particularly at fast food restaurants and many other eateries. Instead, focus on healthier fats, such as omega-3 fatty acids found in fish oils and certain plant oils. Omega-3s are anti-inflammatory and beneficial for liver health. In addition to changing your dietary fats, it's essential to incorporate foods that support liver function. Cruciferous vegetables like cabbage and sauerkraut are excellent for the liver due to their high content of sulfur-containing compounds, which aid in detoxification. Key dietary changes for liver health. Avoid alcohol. Reducing or avoiding alcohol consumption is crucial to protect the liver. Alcohol damages hepatocytes, liver cells, and leads to fat accumulation in the liver, impairing its function and health. Exercise regularly. Fatty liver has become a common problem even among children due to lifestyle changes. Engaging in physical activities, such as walking or moderate exercise, for at least 150 minutes per week is recommended. Lose weight. Losing just 5% of your body weight can have significant benefits for liver health, including reducing inflammation, fibrosis, and hepatic fat, thus improving overall health. Maintain a healthy diet. An inadequate diet often leads to fat accumulation in the liver. A balanced diet is key to reversing this condition. Avoid foods containing high fructose corn syrup and sugar, as they contribute significantly to liver fat. Avoid ultra-processed foods. Processed foods and fast foods contain high levels of sugars, saturated fats, and additives that increase the risk of hepatic steatosis. Avoid refined wheat. Foods such as bread, pasta, and crackers increase liver fat. Reducing refined wheat intake helps prevent fatty liver by managing blood sugar levels and insulin resistance. Avoid vegetable oils. Diets rich in omega-6 fats from vegetable oils cause inflammation. Replace these with healthier fats, such as those from grass-fed, grass-finished animals, and fish oils rich in omega-3 fatty acids. Foods to include for liver health. Fruits, especially avocados, which are high in glutathione, a powerful antioxidant that helps reduce liver fat and promote overall liver health. Whole grains, foods like oat bran, flaxseed, and chia are rich in fiber and omega-3 fatty acids, which are associated with a reduced risk of hepatic steatosis. Cruciferous vegetables, vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk. Olive oil. Consuming 3 to 4 tablespoons of olive oil daily can significantly reduce fat accumulation in the liver. Turmeric. Known for its anti-inflammatory properties, turmeric should be consumed with a pinch of black pepper to enhance absorption and effectiveness. Coffee. Coffee contains caffeine, tocopherol, vitamin E, and chlorogenic acid, which act as antioxidants, reducing liver inflammation and offering protection against liver fibrosis. By making these dietary and lifestyle changes, you can significantly improve your liver health and prevent the progression of fatty liver disease. It's important to be proactive about liver health, given the organ's critical role in detoxification and metabolism. I had a liver problem for many years without realizing it. My symptoms included pain and tightness in my right shoulder and under my right rib cage, which I later discovered were related to my bile ducts. After addressing my liver health through dietary changes and lifestyle adjustments, I completely reversed my liver condition. This experience taught me the importance of recognizing early symptoms and taking preventive measures. The liver's ability to regenerate is remarkable, and with the right approach, you can restore its health and function. Preventing liver disease. Preventing liver disease involves understanding the root causes and making informed choices about diet and lifestyle. Seed oils, often marketed as vegetable oils, are a major culprit in liver damage due to their high content of linoleic acid. These oils are highly inflammatory and damaging, especially when consumed in excess. Replacing these harmful fats with healthier alternatives like omega-3 fatty acids from fish oils and grass-fed animal fats can make a significant difference. Additionally, incorporating liver-friendly foods like cruciferous vegetables and antioxidant-rich fruits can further support liver health. In conclusion, the number one worst food for the liver is seed oils due to their high content of oxidized linoleic acid, which causes inflammation and damage. By eliminating these oils from your diet and replacing them with healthier fats, along with incorporating liver-supportive foods, you can significantly improve your liver health and prevent the progression of fatty liver disease. Remember to avoid alcohol, exercise regularly, maintain a healthy diet, and be proactive about recognizing and addressing early symptoms of liver problems. With these steps, you can protect and support one of your body's most vital organs. Fast food, it's quick, it's tasty, and it's everywhere. From burgers and fries to pizza and fried chicken, these convenient meals have become a staple in many of our diets. However, have you ever stopped to think about what all that fast food might be doing to your liver? Today, we're diving deep into the impact of fast food on your liver health. How exactly does fast food harm your liver, and what can you do to protect yourself while still enjoying the convenience of these meals? Stay tuned as we explore the answers to these critical questions. So, let's get started. Fast food has become an integral part of modern life due to its convenience, affordability, and appealing taste. From burgers and fries to pizza and fried chicken, these quick meals are easily accessible and often irresistible. However, while indulging in fast food occasionally might seem harmless, regular consumption can have significant adverse effects on our health, particularly on the liver. Fast food is typically high in unhealthy fats, sugars, and salt, while being low in essential nutrients. This combination can lead to various health issues, including obesity, heart disease, and type 2 diabetes. One of the most concerning effects of regular fast food consumption is its impact on liver health. The liver is responsible for detoxifying harmful substances, metabolizing fats, and regulating blood sugar levels. When overwhelmed by the unhealthy components of fast food, the liver can suffer severe damage. Harmful effects on the liver. 1. Fatty liver disease. Fast food, characterized by its high content of unhealthy fats, sugars, and salt, has become a dietary staple for many due to its convenience and taste. However, frequent consumption of fast food poses a significant risk to liver health, particularly leading to the development of non-alcoholic fatty liver disease, NAFLD. This condition, often associated with poor dietary habit, NAFLD is characterized by the accumulation of fat in liver cells in individuals who consume little to no alcohol. The pathogenesis of NAFLD is multifactorial, involving genetic predisposition, insulin resistance, oxidative stress, and inflammatory responses. Fast food is rich in saturated fats and trans fats, which are readily stored in the liver. When the intake of these unhealthy fats exceeds the liver's capacity to process and metabolize them, fat starts accumulating in liver cells, leading to hepatic steatosis, the hallmark of NAFLD. High sugar levels, particularly from refined sugars and high fructose corn syrup commonly found in fast foods, contribute to insulin resistance. Insulin resistance impairs the body's ability to regulate glucose, causing increased fat synthesis in the liver. This process exacerbates the accumulation of fat in liver cells, promoting the progression of NAFLD. The presence of excessive fatty acids in the liver triggers oxidative stress and the production of inflammatory cytokines. This inflammatory response can cause hepatocellular injury and fibrosis, further advancing NAFLD to non-alcoholic steatohepatitis, NASH, a more severe form of liver disease characterized by liver inflammation and damage. 2. Toxin overload. The liver's role in detoxification involves metabolizing and neutralizing harmful substances, which are then excreted from the body. However, the constant influx of toxins from regular fast food consumption can overwhelm the liver's capacity, leading to several detrimental effects. Fast foods often contain preservatives like sodium benzoate, nitrates, and nitrites, as well as artificial colors and flavors. These substances, while preventing spoilage and enhancing appearance, require extensive processing by the liver. Over time, the chronic exposure to these chemicals can lead to liver cell damage and impaired liver function. Trans fats and hydrogenated oils, commonly found in fried and processed fast foods, increase inflammation and oxidative stress in the liver. The liver's attempt to process and eliminate these harmful fats results in the production of reactive oxygen species, ROS, which can damage liver cells and promote fibrosis. High fructose corn syrup, HFCS, frequently used in sodas and sweetened fast food items, is metabolized in the liver, leading to the production of harmful substances like uric acid and free radicals. This metabolic burden increases the risk of liver inflammation and fat accumulation, contributing to non-alcoholic fatty liver disease, NAFLD, and other liver disorders. Additionally, certain fast food packaging materials contain chemicals like bisphenol A, BPA, and phthalates, which can leach into the food. These endocrine disruptors interfere with hormonal balance and liver function, further exacerbating the toxic load on the liver. 3. Obesity. Obesity, characterized by excessive body fat accumulation, poses numerous health risks, including severe implications for liver health. Understanding the relationship between fast food consumption, obesity, and liver disease is crucial for addressing this growing public health. Obesity results from an imbalance between caloric intake and energy expenditure, where excessive calories are stored as fat in the body. Fast food, often rich in fats, sugars, and refined carbohydrates, provides a surplus of calories while offering little nutritional benefit. This caloric surplus easily leads to weight gain and obesity. Fast food's poor nutritional quality, lacking essential nutrients like fiber, vitamins, and minerals, can lead to overeating as the body continues to crave nutrients, further exacerbating weight gain. High sugar content, particularly from fructose and refined carbohydrates, promotes insulin resistance, impairing the body's ability to regulate blood sugar levels and leading to increased fat storage, particularly in the abdominal area. Additionally, obesity is associated with a chronic inflammatory state, as adipose tissue produces inflammatory cytokines that contribute to systemic inflammation, impacting various organs, including the liver. Obesity significantly increases the risk of liver-related health issues, particularly non-alcoholic fatty liver disease, NAFLD. In individuals with obesity, the excess fat stored in the liver can lead to hepatic steatosis, the initial stage of NAFLD. If left unchecked, this condition can progress to non-alcoholic steatohepatitis, NASH, fibrosis, and eventually cirrhosis or liver cancer. Insulin resistance, common in obese individuals, exacerbates NAFLD by overwhelming the liver with excess fat and impaired insulin signaling, causing further fat accumulation and liver damage. The chronic inflammation associated with obesity promotes liver inflammation, leading to hepatocellular injury and stimulating fibrogenesis, where excess connective tissue builds up in the liver, leading to fibrosis and potentially cirrhosis. Furthermore, obesity, particularly abdominal obesity, is linked with metabolic syndrome, which includes conditions like hypertension, dyslipidemia, and type 2 diabetes, compounding liver-related issues as the liver is central to lipid and glucose metabolism. 6 Prevention strategies for liver health and obesity. Given the significant health risks associated with fast food consumption, obesity, and liver diseases such as non-alcoholic fatty liver disease, NAFLD, it is crucial to implement effective prevention strategies. These strategies can help mitigate the harmful effects of an unhealthy diet and lifestyle, promoting overall well-being and protecting liver health. Here are some key prevention methods. Dietary modifications. Reduce fast food intake. Limit the consumption of fast foods that are high in unhealthy fats, sugars, and refined carbohydrates. Instead, opt for homemade meals prepared with fresh ingredients. Balanced diet. Emphasize a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. These foods provide essential nutrients and help maintain a healthy weight. Fiber-rich foods. Incorporate more fiber into your diet through fruits, vegetables, legumes, and whole grains. Fiber aids in digestion and helps regulate blood sugar levels, reducing the risk of insulin resistance. Healthy fats. Choose sources of healthy fats such as avocados, nuts, seeds, and olive oil, which are beneficial for liver health and overall well-being. Regular physical activity. Exercise routine. Engage in regular physical activity, including both aerobic exercises, such as walking, running, cycling, and strength training. Aim for at least 150 minutes of moderate intensity exercise per week. Active lifestyle. Incorporate more movement into your daily routine by taking the stairs, walking instead of driving short distances, and participating in recreational activities. Behavioral interventions. Mindful eating. Practice mindful eating by paying attention to hunger and fullness cues, eating slowly, and avoiding distractions such as TV or smartphones during meals. Portion control. Be mindful of portion sizes to avoid overeating. Use smaller plates and bowls to help manage portion sizes. Healthy snacking. Choose healthy snacks such as fruits, nuts, yogurt, or vegetables instead of processed snacks high in sugar and fat. Hydration. Adequate water intake. Stay hydrated by drinking plenty of water throughout the day. Proper hydration supports liver function and overall health. Limit sugary drinks. Reduce the consumption of sugary beverages such as sodas, energy drinks, and sweetened juices, which can contribute to weight gain and liver fat accumulation. Medical monitoring and interventions. Regular check UPS. Schedule regular health checkups, including liver function tests and imaging studies, to monitor liver health and detect any early signs of liver disease. Professional guidance. Seek advice from healthcare professionals, including dietitians and physicians, to develop personalized dietary and exercise plans. Medical interventions. In cases of severe obesity or advanced liver disease, medical or surgical interventions such as pharmacotherapy or bariatric surgery may be necessary. These should be discussed with a healthcare provider. Avoidance of toxins. Reduce exposure. Limit exposure to environmental toxins and chemicals found in certain food packaging materials, such as bisphenol A, BPA, and phthalates. Choose fresh, whole foods over processed and packaged options. Safe food practices. Practice safe food handling and storage to avoid contamination and reduce the intake of preservatives and additives. In conclusion, understanding the harmful effects of fast food on our liver and overall health is crucial. By making informed food choices, adopting a balanced diet, staying active, and practicing mindful eating, we can significantly reduce the risk of obesity and liver diseases. Remember, small changes in our daily habits can lead to big improvements in our health. So, let's take action today to protect our liver and enjoy a healthier life. In this video, you'll discover amazing foods that cleanse these vital organs and tips for preventing liver disease. Stick around until the end, and don't forget to hit that subscribe button for more health insights. Our liver and gallbladder play crucial roles in filtering our blood, which carries various substances like toxins, bacteria, and fungi. Over time, exposure to harmful substances such as alcohol, strong tea or coffee, food additives, prescription drugs, pesticides, and city pollution can weaken the liver. Overeating, especially animal fats, and constipation can make things even worse by overloading the liver. You can support your body's natural cleansing process by incorporating foods that help the liver function optimally. Stay tuned to learn about these powerful, liver-loving foods. 1. Grapefruit. Grapefruit is a powerhouse fruit packed with vitamin C and antioxidants. It naturally kickstarts the liver's cleansing processes. Just one glass of fresh grapefruit juice can jumpstart detoxification and encourage the liver to produce more enzymes. Add this refreshing juice to your daily routine to support your liver's health and vitality. 2. Avocado. Avocado is fantastic for liver health because it helps produce glutathione, essential for detoxifying the liver. Regularly eating avocados can significantly boost liver function. They're packed with amino acids, nutrients, and trace elements that protect and support the liver. Avocados are also rich in fiber, which aids digestion, and antioxidants that help the body eliminate toxins. These creamy fruits are a great source of healthy fats, like omega-3s, which lower bad cholesterol and reduce the risk of heart diseases. Plus, they help fight inflammation throughout the body. 3. Apple. Apples are a simple yet powerful fruit, integral to many healthy diets. Renowned for their benefits since ancient times, apples support both the gallbladder and liver. They are rich in pectin, a type of fiber that cleanses the intestines and liver of toxins and prevents constipation by stimulating bowel movements. Eating an apple a day can increase good cholesterol and decrease bad cholesterol, which helps prevent plaque buildup in blood vessels. Apples aid the liver in processing bad cholesterol and removing cancer-causing toxins from the blood. This detoxifying effect is enhanced by malic acid, which is abundant in apples. 4. Citrus fruits. Citrus fruits, brimming with vitamins, offer numerous benefits for our bodies. They enhance liver function and reduce inflammation, thanks to their rich content of essential oils and vitamin C. This vitamin not only protects against colds and viruses by boosting our immune system but also helps eliminate harmful substances from the body. Fruits like oranges, lemons, and tangerines improve digestion, making them a delicious and healthy addition to our diet. They are particularly beneficial for liver health and detoxification. 5. Olive oil. Olive oil is rich in healthy fats and essential nutrients, making it a fantastic addition to your daily diet. It keeps liver cells functioning optimally, thanks to its abundance of antioxidants and anti-inflammatory properties. Olive oil aids in detoxifying the body and removing harmful substances from the blood. The healthy fats in olive oil also lower bad cholesterol, helping to keep blood vessels clear and reducing the risk of heart disease and other cardiovascular issues. Additionally, olive oil contains vitamins and amino acids that protect cells from damage caused by free radicals, thereby lowering the risk of cancer and other chronic illnesses. 6. Cruciferous vegetables. Cruciferous vegetables, especially broccoli, are outstanding for liver cleansing. Including broccoli or cauliflower in your daily diet boosts the body's production of glucosinolates. These natural enzymes activate detoxification processes, reducing harmful substances and lowering cancer risk. The antioxidants in these vegetables not only help reduce the chance of cancer but also assist in removing toxins from the body. The healthy fats in olive oil also lower bad cholesterol, helping to keep blood vessels clear and reducing the risk of heart disease and other cardiovascular issues. Additionally, olive oil contains vitamins and amino acids that protect cells from damage caused by free radicals, thereby lowering the risk of cancer and other chronic illnesses. 7. Tomatoes. Tomatoes, packed with lycopene and amino acids, are great for liver health when eaten regularly. These nutrients get absorbed into the bloodstream, enhancing liver function and aiding the body's detoxification processes. Tomatoes also contain glutathione, which actively supports and improves liver function. Rich in flavonoids and beta-carotene, natural antioxidants, tomatoes boost blood flow in the liver and protect the body's cells from damage by free radicals. 8. Walnuts. Walnuts are packed with the amino acid arginine, which helps the body remove toxins like nitrogen compounds and ammonia. They're also high in fiber, benefiting the intestines, and rich in omega-3 fatty acids, which support liver health by aiding in blood purification. Eating a small handful of walnuts regularly can lower bad cholesterol and provide the body with healthy fats. Not only are walnuts nutritious, but they are also essential for maintaining liver health and supporting overall body wellness. 9. Garlic. Garlic is a fantastic natural cleaner for the liver. Even just 1 or 2 cloves can help eliminate harmful substances from your body by boosting the activity of liver enzymes. Rich in allicin and selenium, garlic is excellent for aiding liver detoxification. Adding garlic to your diet is an easy and effective way to support liver cleansing at home. 10. Green tea. Green tea is excellent for liver cells due to its high content of plant antioxidants called catechins. These catechins assist the liver in handling toxins and harmful substances, thereby supporting its overall function. 11. Broccoli. Broccoli is not only rich in beneficial micronutrients but also high in dietary fiber. This helps restore bowel movement and cleans blood vessels by lowering bad fats, reducing the risk of heart problems. This vegetable is also packed with vitamin E, a fat-soluble vitamin that our bodies cannot produce. We need to obtain it through our diet. Vitamin E is a natural antioxidant that safeguards liver cells from damage and early aging. It's a vital nutrient for maintaining liver health and promoting overall well-being. 12. Green vegetables. Green vegetables are excellent for liver cleansing, whether consumed as juice, raw, or cooked. They are packed with plant chlorophylls that help remove toxins from the blood and counteract chemicals and heavy metals, such as pesticides, thereby protecting the liver. Including foods like spinach, basil, lettuce, celery, and mustard greens in your diet can significantly boost bile flow and aid in detoxifying the body. 13. Milk thistle, silymarin. Silymarin, found in milk thistle, is a potent antioxidant that enhances the activity of key antioxidants in our body, such as glutathione and superoxide dismutase. Recent studies show that silymarin can nearly double the levels of these antioxidants in the intestines and liver. Glutathione protects cells from toxic damage and inflammation, safeguarding liver cell membranes and reducing toxin absorption. Milk thistle also helps counteract the effects of toxins on cells and aids their recovery. It's particularly useful for treating various liver conditions, including different types of hepatitis, fatty liver disease, and cirrhosis. 14. Turmeric. Turmeric is excellent for the liver. Simply adding it to lentils or other dishes can bring noticeable positive effects. Turmeric not only enhances flavor but also boosts liver function. Alongside turmeric, incorporating foods like asparagus, artichokes, and Brussels sprouts into your diet is beneficial. These vegetables are not only nutritious but also essential for maintaining a healthy and detoxified liver. Eating these regularly supports liver health and overall well-being. 15. Beets and carrots. Beets and carrots are a fantastic combination, loaded with beneficial nutrients. They are rich in flavonoids, vitamin A, and beta-carotene, which is also great for eye health. These nutrients work together to enhance the liver's functions and keep it active. Liver disease prevention, key steps beyond cleansing. It's essential to understand that cleansing the liver alone isn't enough to maintain its health. Here are other crucial preventive measures. 1. Stop harmful habits. Stay away from alcohol and quit smoking. Both can damage liver cells and lead to serious diseases. 2. Maintain a healthy weight. Keep your weight in the normal range, aiming for a body mass index, BMI, between 18 and 25. 3. Make diet changes. Cut out fatty, fried, and fast foods, and reduce sweets. Focus on a balanced, healthy diet rich in fruits, vegetables, lean proteins, and whole grains. 4. Exercise regularly. Regular physical activity is crucial. Being overweight can cause fatty liver disease, including the non-alcoholic type. Aim for at least 30 minutes of exercise most days of the week. 5. Consider genetic factors. If liver disease runs in your family, be extra vigilant about your health. Regular doctor visits and checkups are important, as liver diseases often don't cause pain and can be detected late. Always talk to a healthcare provider before trying any liver cleansing methods. Only a specialist can assess all risks and potential side effects. If you found this video helpful, please subscribe to our channel. Thanks for watching, and I'll see you in the next video from the Health